On with it. So welcome to the California Reducing Disparities Project Conference. This day has been a long time coming, and it's a welcome closing step to the finalization of the report. But more importantly, this is actually a beginning step to the change that we want to see in our mental health system. Mental health is deeply, deeply personal. And I would venture that probably everyone in this room has had that moment when you thought, I need help. But whether or not you felt safe to ask, whether or not you felt you understood where you could go, whether or not you were worried that maybe your abuela, your tia, your mother, your father, your neighbors would find out that you needed help, that maybe kept you or someone else that you know from seeking services. And that's the reason why we're here today. The personal is political. And that's going to be a huge theme that you'll see throughout the day from the various different speakers. That for far too long, communities of color and LGBT communities have had poor access and as a result, poor health outcomes in overall health, but especially within mental health. Mental health and substance use conditions are one of the leading causes of disease burden in the United States. And mental health mortality rates in the United States are far higher than other countries that have similar wealth as us. And despite healthcare gains, because we're really proud of all the healthcare coverage that we've been able to do, study after study shows that communities of color and LGBT communities continue to lag behind in terms of seeking and receiving treatment for mental health care. So the work of the Phase 1 CRDP partners and now the Phase 2 partners, it has been foundational to lifting up the voices, experiences, and needs of the 5 communities that were outlined: the African American, Native American, Asian Pacific Islander, Latino, and LGBT community. So their work and their recommendations are the backbone of the recommendations that you're going to hear about today for the strategic plan to reduce mental health disparities. And even while this conference and this report have been delayed, I actually think that things happen for a reason. And that really this conference couldn't have happened at a better time. Because we're seeing now that there is a possibility of change with new projects. We're seeing many programs that are helping people transition from being incarcerated back into their communities. We're seeing people stand allied with immigrant communities to say, hey, we protest these deplorable immigration deportation strategies. And we're seeing youth take on these huge issues of gun control and school bullying. So the types of initiatives that we're hoping to lift up today in this conference are those types of initiatives that we're going to be thinking about and learning about in the workshops today. And they're really to provide you all with the tools, the strategies, and the inspiration for change. We know that mental health interacts with so many other social and economic conditions. And so today is about taking that necessary change in order to make sure that our communities have a better chance to succeed. So the focus of the strategic plan to reduce mental health disparities is to highlight the resilience in our communities, the resilience that they're showing through their variety of different customs and traditions that are both rooted in the history and traditions, but who are also adapting and being innovative over time as well. This year, CPEN is celebrating 25 years of advancing health equity, and our founders came together from 4 racial and ethnic leadership at a time of which we're seeing right now, this racial divisiveness, when immigrants are being scapegoated. And the powers that be wanted to create this rift between our communities so that it maintained the status quo. Well, when I think of the founders' vision for change, I think about this report and that it has the potential to unlock change. So I think one of the reasons why this report has taken so long is because it is calling on a fundamental change to our mental health care system, right? But that's not a bad thing. And so today we really have the opportunity to hear and listen how we're going to be able to make those changes needed to our mental health care system. So again, I want to thank you for being here today. I want to thank you for your participation and for your attention. And I do look forward to working with you at the beginning stages of taking this report to the next level. Thank you very much. Okay, so as the First Lady of New York City, Chirlane McCray has redefined the role of First Lady. Ms. McCray is a longtime outspoken advocate and leader in the world of mental health, domestic violence, and community resilience as a public servant, as a public relations professional, and as a writer. She has inspired and supported people living with mental health challenges to share their story, including her own family. In a poem entitled Just Right from 2014, she writes, "Be the truth." She has traveled to Puerto Rico in the wake of the Hurricane Maria disaster to help people with mental health needs living in Puerto Rico. And she founded the city's Thrive Coalition to advocate for a more integrated and better funded behavioral health system. The coalition includes 150 mayors and has done things like advocated for the Affordable Care Act. And she has created Thrive NYC, a mental health plan for New York City that's been described as the most comprehensive of any city or state in the nation. It has 6 guiding principles that you will hear about, but that I think are really important and aligned with the CRDP. Change the culture, act early, close treatment gaps, partner with communities, use better data, and strengthen government's ability to lead. In addition to her tremendous leadership with Thrive NYC, Ms. McCray serves as the chair of the Mayor's Fund to Advance NYC, is the co-chair of the Commission on Gender Equity, and is a member of the NYC Domestic Violence Task Force. And her accomplishments have been widely recognized. She's received an honorary degree from the CUNY Graduate School of Public Health and Health Policy. She's the 2017 Champion for Change awardee from the National Council of Behavioral Health. And Ms. McCray has received the Black Women's Agenda Health Award in 2016. Please join me in welcoming the amazing leader and advocate of New York City, Chirlane McCray. And welcome.
All right. Good morning, everyone. Thank you, Sarah, for your kind words, for your leadership. This is a little strange. I'll get used to talking to the screen. I can see some of you, but I want to thank everyone at California Pan-Ethnic Health Network for the invitation to join all of you today. I hear it's 76 degrees in LA, and I wish I could be there in person. And not only because it's taking so long for spring to get to New York, I'm really delighted to have this opportunity to speak with you in any way that I can because of all the good work that you're doing. And I'm honored to be part of a conference that's challenging age-old inequities in our healthcare system. In New York last week, like many cities across the country, we honored and celebrated Dr. King's vision as we marked the tragic 50th anniversary of his death. 50 years after he was taken from us, it's clear that we have a long climb ahead to reach the mountaintop that he spoke of in his final speech. But as I look back, I also see the incredible distance that we've traveled. And I'm heartened and inspired by all the people from coast to coast who work so hard to make his vision a reality every day. And that includes all of you. You are taking on the kinds of disparities Dr. King fought so hard to address. As he once said, of all the forms of inequality, injustice in health is the most shocking and inhuman. Following major national victories like the Civil Rights and Voting Rights Acts, healthcare became one of the new frontiers of the civil rights movement. At that time, I was a young teenager in a world that seemed full of possibilities. I only had to look at my parents to believe that if you work hard enough, the impossible is possible. My father was a World War II veteran, my mother, the daughter of immigrants from the Caribbean, and they worked really hard to provide us with an excellent education and opportunities that they could never have dreamed of. We were privileged as a working class family to live in a middle to upper middle class suburb in Western Massachusetts, but that meant that from kindergarten through high school, I was the only Black student in all of my classes. And there are always people who meant well, but I was often bullied, sometimes chased home by classmates, spit on, and even tougher was the ostracism, the taunting, the harassment. Um, my difficulties in school were exacerbated by the fact that my amazing, hardworking parents were often withdrawn and didn't communicate much with us. Part of it was the generation we grew up in, but part of it was what they were going through. Looking back, I can see the signs of depression very clearly. But back then, I didn't know. I didn't know what was going on. I didn't understand that as a child. I just felt like there just wasn't much joy in our beautiful home, and which led to a lot of anxiety. Stories of illness unspoken and the resulting confusion, uncertainty, and hurt are strikingly common. I can't see all of you, but I'm going to ask you a question anyway. How many of you have been affected by mental illness or substance misuse, either directly or through someone that you care about? Can you please raise your hand? Okay, I can't see everyone, but I believe most of the hands are up right now. I ask this question everywhere I go, and I always say that if your hand is not up, you probably don't know your friends or your family as well as you think you do. So think about it. If 1 in 5 Americans struggles with a mental health condition in any given year, the other 4 in 5 are sisters, brothers, parents, friends, neighbors, coworkers. No zip code, no income bracket, no religion or ethnicity is untouched. And when mental illness and substance misuse go untreated, we all suffer from the consequences. So these are not other people's problems. We're all in this together. And together is how we must move forward. The progress we have achieved over the past 50 years is remarkable, but stark disparities remain, rooted in our country's history. Slavery, Jim Crow, the horrific treatment of Native peoples, the marginalization of immigrant communities, LGBTQ people, and the poor. The legacy of these injustices and all of our country's interlocking systems of oppression live on today. The challenges of mental illness and substance misuse are shared, but they are not shared equally. I see living proof of that every day. In community conversations I've hosted across New York City's 5 boroughs, people often share their stories, their difficulties in getting the help that they need for themselves or their families. Not so long ago, one woman tried valiantly, she told me, without success to find an African-American mental health professional she could afford for her teenage daughter. Now, it's no surprise that this was so difficult for her because only 5% of the psychologists in our nation are African-American. 5%. And there are geographic disparities as well. Manhattan has 1 psychiatrist for every 1,300 residents. But in the Bronx, it's 1 psychiatrist for every 13,000 residents. Language and cultural barriers to mental health care are way too common. First-generation immigrants trying to find help for their parents who speak very little English often don't even know where to begin. So how do we get them the care that they need? How do we make sure that the undocumented and their families under constant attack by federal leaders and living in the shadows can safely access services when there's so little trust? I've spent time with transgender young people who have left or been forced out of their homes because of family discomfort or hostility to their gender identity and sexual orientation. And now they're living on their own, sometimes in shelters. And their resilience is awe-inspiring, but in the quest for survival, their trauma is too often overlooked. And the nationwide opioid crisis is receiving much more attention now than it was because of the devastating effects that opioids are having on rural white communities and the involvement of the pharmaceutical industry. But heroin has been around for a long time. I've spent time with folks in the Bronx who can map its damage across generations of families. And we know that opioid use is now increasing in communities of color. Our mental health services do not meet the needs of all of our people. Our mental health force is not adequate to meet the needs of all of our people, which is why our movement for equity must be nimble, creative, and bold. And that's the idea behind Thrive NYC, our public health approach to change the culture around mental health and change the way we deliver services. Using New York City as a laboratory for change, we are finding new solutions to address these injustices and inequities head on and to reform the systems that cause them. Thrive is narrowing massive treatment gaps with task shifting and by working in partnership with community-based first responders. We are placing social workers, clinicians, and peer workers where they are needed most, in homeless shelters, family justice centers for domestic violence survivors, working with primary care facilities in underserved communities, and at the bedsides of recent overdose survivors. We are acting early, embedding social emotional learning into our free pre-K for all curriculums, and adding dedicated mental health support for all 1,800 of our schools. And we're doing something that is harder to measure too. We're changing the way people think about mental health. This is perhaps the most important thing that we can do. Because everywhere I go, and New York is an international city, people tell me how stigma in their community is the biggest barrier to mental health, mental wellness. This is what people say. Well, in my community, the stigma is really bad. No, it's really bad, worse than in other communities. Everybody says that. It could be the Russian community, it could be the Latino community, it could be the Chinese community. Everyone says, in my community, the stigma is really bad. Everyone ranks it as the #1 challenge. So I'm sure you see that in your work as well, and we can't ignore that. If people can't talk about mental illness and addiction, they can't even talk about it. How do we expect them to be able to reach out for services? How do we expect them to be open to getting care? That's why one of the things we're doing here in New York City is using public awareness campaigns to break through that stigma. Millions of New Yorkers have seen our ads in subways and buses, on Facebook and in local ethnic media, all with one message: you are not alone and help is available. We also know that people prefer to get services in their own communities, the communities where they live and from people that they trust. So Thrive is partnering with trusted community organizations and training city workers and community leaders to help us reach people where they live, where they learn, where they work, and where they worship. This is not an if you build it, they will come situation. This is a we will build it and we will bring it to you kind of situation. And it's a we will build it, we will test it, we will analyze, we will ask questions, we will modify, and we will never stop until it's right for you kind of situation. And that's why we created an amazing public engagement team to get information out about Thrive services. This engagement team goes to barbershops and beauty salons, playgrounds, wherever people gather in any given community. And like our 24-hour multilingual helpline called NYC Well, with trained counselors who help people make appointments with mental health professionals and get the services they need, we're just making sure that there's always some place for people to turn. Always. There can be no wrong door to getting services. With NYC Well, we're closely monitoring where the calls are coming from to make sure that the people who need the service are actually using the service. For example, this is what we've recently learned. We have both Mandarin and Cantonese speaking counselors staffing the helpline, but not as many of those calls are coming in as we projected. So we know better than to assume that there are just no challenges in the Chinese immigrant communities. So we're partnering now with trusted institutions like the Asian American Federation to figure out a better approach. How do we make sure that we're doing this the right way. How do we make sure that people are getting their needs addressed? And to reach deeper into Black communities, we launched an unprecedented collaboration among 6 historic Black women-led organizations. You know, the Alphas, Deltas, Thetas, Gammas, the Links, and Jack and Jill. Some of you may have heard of them. And we're calling this partnership between government and these organizations Sisters Thrive. We're all working together to train 10,000 of their members, their New York City members, and their friends and their family members in mental health first aid. Mental health first aid is a course that provides what most people don't get when they're growing up: a basic understanding of mental illness, substance misuse, and addiction, and the skills to help people in need. I like to think of it as CPR, as a CPR class, but for emotional behavior. And it's useful all the time, not just in emergency situations. Think about it this way. We all know what to do when someone's bleeding and who to call if the injury is serious, right? We know what to do. We learned this when we're growing up. We clean the area around the wound, apply a bandage, apply pressure if it doesn't stop. But so few people know what to do when someone is having a panic attack, or if someone is spending week after week struggling to get out of bed because they're struggling from depression, they're suffering from depression. We don't have these very basic skills or understanding of how to respond. We have to change that and train more people as mental health helpers and healers. And we're not stopping with Sisters Thrive. We're going to work with our brothers too, and we're going to work with every community we can until we can train 250,000 New Yorkers. We know that we just have to raise the level of awareness way up before we're able to get where we need to be. That's why we're offering the course for free in New York City, but this course is available all over the country. And all you have to do is visit mentalhealthfirstaid.org to see options near you. Or perhaps your organizations or your government can host group sessions for your communities. Please check it out. I highly recommend it. I took the course myself and I found it transforming. It changed my life. And here's another way you can be a helper and a healer. One of our most successful partnerships has been with faith leaders across the city and across the country. From May 17th to 20th, we are hosting our 3rd annual Mental Health Weekend of Faith. In the previous 2 years, thousands of houses of worship from across faith traditions and across the country devoted their weekend services to addressing the stigma around mental illness and addiction and encouraging people to seek help if they needed it. It's a fantastic way to have a public conversation, to change the culture, to dismantle stigma, and also direct people to where the resources are, which many people just don't even know where to look. And this year, we are hoping to reach even more people. I know many faith communities across California are already involved, but we need even more participation. If you're part of a faith community, please encourage your house of worship to participate. Okay, all you have to do is go to our website, citiesthrive.org, and you'll be able to sign up. And of course, you don't have to be part of a faith community to make change. Whatever brings you to this conference, whether it's because you work in government, maybe you're an advocate, a researcher, or a clinician, you're still part of a powerful movement for change. And we all have more power than we actually use, more power than we realize we have. We want to harness it. We want to combine it with others. Start where you are, use what you have, and do what you can. You'll find that we can achieve much more than you even thought possible. Your friends in New York City are here to help. The Thrive principles, which reflect the fact that no one size fits all, are yours to review and to use. In fact, our framework is already loaded onto your flash drives, so please check it out. And we want to learn from you too. And that's why we created Cities Thrive, a coalition of mayors, thought leaders, and organizations to share best practices and advocate for a better funded, better integrated behavioral health system. The coalition has grown so quickly. We now have more than 200 cities represented in all 50 states, and Washington, D.C. and Puerto Rico. LA County just joined, and nearly 20 other localities from Long Beach to Sacramento to Oakland are already part of the coalition. If your city or your county is not a member, please reach out to your local leaders and ask them to join us. We want to be able to share all the information we have from our legislative office in Washington, where you get weekly updates on what they're doing in Congress or what they're not doing, where the funding is going or not going, and everything that people are doing across the country in terms of really innovative mental health programs. Last Saturday, just a few days ago, I was in New Hampshire visiting the safe stations in Manchester and Nashua, New Hampshire. This is the kind of information we are sharing with all of our Cities Thrive Coalition members so they can reach their communities, because our communities are so different. We need to be creative and resourceful in how we get to them. We especially encourage more California counties to join, because we know you have so much control when it comes to your local health systems. And Cities Thrive is a powerful platform to share information with other reformers, but it's also a way to amplify your voices. You can visit nyc.gov/citiesthrive to learn more. And I'll repeat that. That's nyc.gov/citiesthrive. Given the times we're in, the Cities Thrive Coalition is more important than ever. Well, that guy in the White House proposes outmoded solutions like locking people away and refusing to respond appropriately to the opioid crisis. We have to fight together to create the behavioral health system that we need, the behavioral health system that our people need. There is so much work ahead of us, but we can do it. We are up to it, and we are strengthened by working together. I would like to conclude by with all of us joining in together to make a pledge. I think I have it set up so I can actually hear you now. Can you all please stand and repeat after me? Stand up, please. I will share my mental health story.
I will share my mental health story.
I will fight for mental health equity.
I will fight for mental health equity.
I will start where I am.
I will start where I am.
Use what I have.
Use what I have.
And do what I can.
And do what I can.
Thank you all again. Let's promote wellness and build a healthcare system that serves everyone. Thank you.